Every 30 seconds, someone in the world loses a leg to diabetes complications. इसलिए नहीं कि उनकी शुगर बहुत हाई है, पर इसलिए कि उन्होंने पुअर सर्कुलेशंस की अर्ली वार्निंग साइंस मिस कर दी। और सबसे बड़ी बात क्या है? इंडिया में 10 करोड़ लोगों को डायबिटीज है and most don't even know that their blood vessels are silently dying until it's too late. मैं डॉक्टर सुमित कपाडिया, वैस्कुलर सर्जन, आपको अगले 8 मिनट्स में ऐसी 5 डेफिनेटिव साइंस बताऊंगा जो डायबिटीज की वजह से सर्कुलेशन डैमेज को डिटेक्ट करने में काम आएगी और आप ये सारी एग्जैक्ट सेल्फ टेस्ट्स खुद कर सकते हैं. By the end of this video, you will know more about protecting your circulation than 95% of diabetic patients. So please hit that subscribe button and never miss life-saving information like this. Sign number 5 is that your feet are cold when they shouldn't be. And I want you to do this test with me right now. Take off your socks if you're wearing them and do the way that I am showing. Touch your feet with your hands. Try to use the back of the hands when you do it. How do they feel? Cold, cool, warm? Now touch your thighs or upper arm and compare the temperature. Your feet should be roughly the same temperature as the rest of your body. Maybe slightly cooler, but not noticeably cold. But if your feet feel ice cold as compared to your arms or legs, that's a red flag. It means blood isn't reaching your feet efficiently. When diabetes damages your arteries, they become narrow and stiff. So less blood reaches your feet, so they start losing heat. This is often the first warning sign, appearing years before pain or wounds develop. Do the test right now and let me know whether your feet are colder than your arms. Comment yes and I'll share you a checklist that you can apply immediately. We call this problem as peripheral arterial disease or PAD. And people with diabetes are 4 times likely to develop PAD as compared to people who do not have diabetes. And here's the scary part. 50% of people with PAD have no symptoms in the early stages. That's why this temperature test is so important. Coming to sign number 4, small wounds that refuse to heal. Think back to the last time you got a cut, scratch or blister on your foot. How long did it take to heal? Any wound on your foot that takes longer than 2 weeks to heal can be a warning sign of poor circulation. Normally, blood carries oxygen and nutrients that repair tissue, but when circulation is poor, your body literally can't deliver the building blocks needed for healing. Additionally, without good blood flow, your immune cells also don't reach the wound. That's why diabetic foot wounds get infected so easily. I treated a 58-year-old patient last month who ignored a small blister for 3 weeks. And by the time he came to me, the infection had spread to the whole foot and the bone. We managed to save his foot, but it required 6 weeks of IV antibiotics and multiple procedures. All that started from just a small blister. So check your feet every single day. Look for any cuts, blisters or stitches. And if you find one, mark the date on your calendar. And if it doesn't improve in 2 weeks, see a vascular specialist. Have you ever had a foot wound that took weeks to heal? Comment how long it took. This helps others understand what's normal versus dangerous. Sign number 3 is the 3-second test that reveals your circulation so fast. And you can do this the way that I am showing right now. This is called as the Capillary Refill Test, where you press down firmly on your toenails for 5 seconds. You'll see that it turns white as you squeeze the blood out. Now, when you release the pressure and count how many seconds it takes for the pink color to return. Now, here I am pressing the toenail and releasing, and watch carefully what happens. The pink color should return in less than 2 seconds. That's instant healthy circulation. But if it takes 3 seconds or longer, or the nail stays pale and white, your blood flow is compromised. Capillaries are the tiniest blood vessels that deliver oxygen to your tissue. So when you press the nail, you temporarily block the blood flow. How fast it returns tells us how strong your circulation is. A refill time over 3 seconds suggests significant arterial blockage. This sign often appears before you feel any pain or notice other symptoms. Do the test right now and comment how many seconds did it take for your toe to return to the pink color. So if your capillary refill is slow and you have cold feet, you need to see a vascular surgeon within the next 7 days. These two signs together indicate moderate to severe arterial blockage. Now moving on to sign number 2, if you have pain that stops you in your tracks, if you have seen or noticed pain or cramping in your calf, thigh or buttocks when you walk, the pain that forces you to stop and rest, it could be a sign of peripheral arterial disease. In medical terms, this is called as claudication, and it's your muscles which are screaming for oxygen. Pay attention to how far you can walk before the pain starts. And if it is less than 500 meters, that could be really significant. But if less than 200 meters, then you need to see a vascular surgeon early. When you walk, your leg muscles need oxygen-rich blood. But when arteries are blocked, they cannot give enough blood flow to the muscles. So the muscles run out of oxygen and start producing lactic acid, causing that burning, cramping pain. But the most important sign of claudication is that the pain disappears within 5 minutes of rest. Once your muscles stop working, they need less oxygen, so the pain goes away. However, if you are experiencing pain at rest, especially at night when lying down, this can be a medical emergency. It means your circulation is so poor that even resting muscles aren't getting enough blood. This in medical language is called as critical limb ischemia, and it means that you need to see a vascular surgeon at the earliest. Coming to sign number 1, your feet are trying to tell you something. Look at your feet right now. Really look at them. What do you see? So look for these 5 visual warning signs. If you have shiny, tight skin, it means there could be some amount of reduced blood circulation. If there is hair loss on your legs and feet, because hair follicles also need blood to survive, no circulation, hair falls and doesn't grow back. Thickened toenails also means that the nails are growing slowly and abnormally. They become thick, brittle and discolored. Pale or white skin, especially when you elevate your leg. Or sometimes the leg becomes red or purple when you keep it down. In severe cases, it may become blue or black, which suggests the onset of gangrene. And 5th, look for any skin ulcers or wounds, especially on pressure points like the heels or ball of feet and even between your toes. These are areas where gangrene can just start without any other warning signs. So if you see that color being black or brown, it means it is onset of gangrene or tissue death. This is a medical emergency which would require immediate hospitalization. Now here's the good news. If you caught any of these warning signs early, circulation problems can be improved, often drastically. So remember the 3-level treatment approach that I advise to all my patients. The first level is lifestyle and medicine. It works for early stage PAD where you control your blood sugars, keep your HbA1c below 7. Even a reduction in HbA1c by 1 reduces the amputation risk by 40%. Daily walking, 30 minutes of walking is literally medicine. It forces your body to grow new collaterals or blood vessels around the blockages. Third important thing is to quit smoking. Smoking constricts arteries and accelerates atherosclerosis. Quitting will improve the circulation within a few weeks. Coming to level 2, which is intensive medical management by using antiplatelet drugs which help to prevent clots, statins which help to protect artery walls and reduce the plaque, blood pressure control which also reduces the vessel strain. These medications are very important for people who have peripheral arterial disease. Coming to level 3, where people who have ulcers which are not healing, rest pain or critical limb ischemia or gangrene, they need to undergo some intervention, which could be either an angioplasty, which is a minimally invasive method by using balloons, stents, or newer devices, or sometimes by doing what is called as surgical revascularization or using a leg bypass. So remember, the earlier you catch circulation problems, the simpler the treatment. Level 1 lifestyle changes can prevent you from ever needing the level 3 surgery. So as a reminder, let me give you the exact action steps based on what you found during this video. If you have less than one of these warning signs, then you only need to maintain strict blood sugar control, walk for 30 minutes and check your feet every night. But if you have more than 2 warning signs, you need to see a vascular surgeon within the next 2 weeks. Get an ABI or a Doppler ultrasound done and they will start you with antiplatelet medications. You may also consider supervised exercise therapy. Now, if you have more than 4 of these warning signs, this is urgent. You need to see a vascular surgeon within the next 3 days. You will probably need to undergo some kind of an angiography and then a treatment. Do not wait because tissue death can happen very quickly. And here's what I want you to remember. Every 30 seconds, someone loses a leg to diabetes complications. But 95% of those amputations are preventable with early detection and proper care. So if you know someone with diabetes, a parent, spouse, friend, or even a colleague, send this video to them right now. You could literally help prevent an amputation.